Welcome to It's All Mental, a podcast from Everyturn Mental Health. We're here to talk about every high and low, no limits, just good conversation.
Hi everybody, and welcome to today's episode of It's All Mental. I'm Emily Evans, the Deputy Chief Exec at Everyturn Mental Health, and today I'm delighted to be joined by Andy Bell from the Centre for Mental Health. As this is the last episode of this season, we're going to be diving into a big question. And today's big question is the mental health system just broken? Before we dive into that big question, Andy, would you like just to introduce yourself and maybe tell us a little bit about the work of the Centre?
Thanks a lot. Thank you. I'm Andy Bell. I'm Chief Executive of Centre for Mental Health. We're an independent charity. We've been around in one form or another for 40 years. So we're celebrating our 4 decades of our work this year. And our focus is really on tackling inequalities in mental health. We do that predominantly through research, evaluation, policy analysis, and a whole range of other work, including supporting networks, convening lived experience, and providing some training in specific areas. But our reason for being is to tackle the inequalities we see across the lifespan in terms of our mental health and well-being and the lives of people with mental health difficulties.
Brilliant. We're very well placed to dive into this question today, and thank you again for joining us, Andy. Let's start with the people who are accessing or trying to access mental health support. Why do you think people are having to wait so long for the support that they need?
It's a really good question, and I think inevitably in a health system where thankfully we have a national health service, the only way in which you can kind of ration services if there's more people that need support than you can possibly support, and there's limited capacity, making people wait is one of the main ways in which that service, that resource is managed, if you like. We see, for example, whenever the NHS is under stress, you see higher waits for elective surgery, don't you? And those are the kind of figures that get on the news and people focus on. But of course, in the mental health system, we have waits too. But we also see that the other ways that things are managed, if you like, is services have thresholds, different criteria that mean that you can have access to that service or not. So again, people are either told to wait or they're told you're not unwell enough at the moment, come back when you're more unwell. And that's really problematic. So there's a lot of hidden waiting. Partly because mental health waits are not given the same political precedence as those for physical health care. And there's no justification for that. There's no need or justification for that. But secondly, some people are told that they're not quite ready for support yet, or there's various reasons why they don't fit the criteria for a particular service. So there is an awful lot of unmet need.
Yeah, and you talked about the work that the Centre does around health inequality and tackling inequalities. Which groups of people would you say consistently fall through the cracks in mental health provision, and what does that say about inequality and fairness in the system?
Yeah, I guess one of the challenges is that we have a system which is struggling to keep up with demand across the piece. So in some ways, anyone can experience a long wait for mental health support. It can happen to anybody. But I think what we do observe is groups of people that actually have the biggest risks to their mental health and have some of the most significant difficulties also have the poorest access to healthcare. So we know, for example, that the people who are neurodiverse have higher rates of mental distress. That's not inevitable, but the way society treats people who are autistic or have ADHD or other neurodiversities means that they experience high levels of distress, but they may find that mental health services aren't adapted to meet their needs. We also see that people whose needs are regarded as too complex. Again, that's a very problematic notion, but we see it very often. So for example, someone who's having difficulties with drugs or alcohol or other substance use problems may find that they need support for that and their mental health, but neither service is actually willing to meet their needs because they are regarded as too complicated. And there's a particular gap between what kind of you can get from NHS talking therapies in England and what you can get from specialist community services. And many people fall into those gaps, unfortunately.
Yeah. And I think what we also see is that postcode lottery, don't we, in terms of kind of the provision can be very different in one particular area to another area. So yeah, we'll come on to talk a little bit about, I guess, what some of the solutions to that might be and what we might like to see in the future. But I guess just to think a bit more around the barriers first, there's been a lot of work on stigma around mental health and big campaigns around destigmatizing people talking about their mental health, that becoming more part of day-to-day conversations. Do you think that stigma is still a barrier today, or is it more the system itself?
I mean, it's a really interesting question. And I think the thing about stigma is it finds new ways to assert itself. And as you say, we had many years of some very successful campaigns that have helped to really change the way we talk and think about our mental health. And they've had a particularly strong effect on younger generations. And so there's more awareness, there's more conversation, there's more belief that looking after your mental health is something you should do. There's more willingness for people to seek help when they need help with their mental health. And again, we had all those years where we knew that people were struggling with their mental health, but for example, didn't want to tell someone at work, or didn't want to disclose at school, or didn't want to go and see their GP. And that still happens to some extent, but much less. Yeah. And that's a really, really brilliant change in our society, and one that some people get freaked out by, but actually it's an incredibly progressive change, and one that we probably need more of rather than less. But I think we do still see different types of stigma appearing. We know that particularly for people living with severe mental illness, there are still residual kind of misunderstandings about the connection between that and violence, for example. And I think we increasingly see a stigma around common mental health difficulties where people are needing financial support. So, for example, where people are seeking disability benefits or unable to work. There's almost a kind of a redefinition of that awful notion of people being undeserving. And we've seen it from successive governments, actually, and media commentators and others, and it has a pernicious effect. So stigma's definitely alive and well, even though we have been fighting it for some time. We have to keep pushing, because it finds new ways to redefine itself, and it causes immense harm. It's not just kind of words. It really, really matters.
Yeah, totally. And I completely agree. And particularly when you see the media or really significant figures within government talking about, things like this, the wrong people are on the waiting list, or there is a tendency to overdiagnose certain conditions. It's really not helpful, is it, in actually, people getting the support they need and making sometimes that first step to getting some support.
I think the reality is that things have been, because we now have that greater freedom, and we recognize both mental health difficulties and neurodiversities. And again, there is a tendency to conflate those. For people that don't know what this is really about, there is a tendency to conflate them and to confuse them. But both are now out and about, and I think there is a tendency to try to put things back and to row back on the progress we've made. And I hope we don't. Because we've come a long way, and we need to see that through to its conclusion, rather than to try to stuff it back in the box and hope it will go away.
Absolutely, yeah. Why do you think there's a tendency to keep physical and mental health separate? So, for example, we in recent months have seen the release of the new NHS 10-year plan. There's a focus within that on mental health emergency departments. And I guess the inclination of that is that will be a separate mental health emergency department to physical health EDs. That's just one example, but why do you think there is a tendency to keep physical and mental health separate?
It's incredibly frustrating because we know the consequences of that are dire. So we know, for example, that if you live with a long-term physical condition, let's say diabetes or heart disease, or you had or survived cancer, you've got double the chance of having a common mental health problem. And if you have poor mental health, it makes it harder to manage your long-term condition, and it causes all manner of distress and difficulty. It also costs the NHS a very large amount of money to undertreat mental health difficulties. But we also know on the flip side that people living with severe mental illness have a vastly reduced life expectancy and much poorer physical health throughout life, from teenage years onwards. So we know this is not just kind of unfortunate, it's actually immensely harmful. I mean, the reasons for this go quite deep. There is a tendency in the clinical professions to separate out mental and physical health. So from a very young age, people who train to be a doctor or a nurse or other things, they have to specialize in one or the other. And particularly in the physical health world, there is a tendency to look down on mental health services and mental health professionals and see it as being not proper medicine. There is, I think, a fear of working with people with mental illness or talking about mental health for professionals who maybe don't have that knowledge and awareness and understanding yet. And then I think, again, you've got a system which is under immense pressure. We've got very, very long waiting lists for surgery. We've got every bit of the system is working under enormous pressure. It's very hard in those circumstances to open up and want to create space for people to talk about their mental health, for example, or to try to adapt physical health services to meet the needs of people with mental health difficulties. The effect of that, of course, is very expensive. It costs a lot of money to keep mental and physical health separate, but I don't think there is either the willingness or the space in the system to do the things they need to do to make that change.
Yeah, definitely. Which leads me on to my next question really nicely, actually. So we've talked a lot about what the challenges are and what some of the big issues are within the mental health system and I guess the healthcare and social care system overall. Do you think when we start thinking about what some of the solutions could be to those challenges, do we need more money, or is it a fundamental redesign of how services are delivered? What would you say to that?
Is it allowed to say a bit of both?
Yeah.
I mean, the reality is that the funding that goes into people's mental health is very, very inadequate compared to levels of need. So we saw the share of spend for mental health services in the NHS go down last year. Now the total spend went up, but the total spend across the system went up faster. So we spend less than 9%, less than £1 in 11 of the NHS on mental health support. And yet we know that it probably accounts for about 20% of all health need. Now, even if you assume that other services tend to be more expensive because they use more complex machinery than we do, that's still undertreating it by a half, isn't it? So I think we have a system which has got very rooted in under investing in mental health services, and all the efforts we've seen over the last few years to boost the workforce, to build up community services, they've done a lot of good. If we hadn't had that, we would be in a world of trouble right now, much worse than it is. But it kind of feels like nothing's happening. It feels like we're kind of running faster, but the world is running a little bit faster still. So I think we do need that investment. We do need to kind of put public money into mental health support. We also need to do more to prevent mental health difficulties. because again, prevention and early intervention can avert some later cost.
Mm-hmm.
So it's also then about using the money we've got as well as we can.
Yeah.
And this is where it gets difficult, because you've got a system at the moment that's predicated on intervening late, waiting for someone to become very unwell, often using coercive and punitive responses to distress. And you can't just stop. You can't just stop providing urgent care for people who are in an emergency situation. You can't just stop providing inpatient services um, for people who are very unwell and need that extra care. So we know that ultimately we need that left shift, as it's called, um, towards prevention, towards earlier help, towards more supporting communities. And it's still remarkable, I think, that about half of all the money that goes into specialist mental health services goes into inpatient care, and yet that only supports a tiny proportion of people.
Mm-hmm.
So if we could reinvest even a small amount of funding, I'm not talking about closing beds and reducing the capacity of services that are already struggling, but even a small amount of reinvestment could help make that system work better. But it's a lot easier if we're increasing the total amount of funding coming into the mental health system rather than robbing Peter to pay Paul.
Yeah, definitely. And I completely agree. We have to keep campaigning around investment in mental health services. Like you said, there has been some worrying kind of signs in terms of that proportion of spend on mental health. And I think organisations like the Centre for Mental Health, like Everyturn, like lots of other campaigning organisations, we have to keep raising those voices of the people who need support to really campaign for that investment. At Everyturn, we do a lot of work in that more kind of community facing prevention space, and we know that prevents people needing to have more acute support, prevents admissions in terms of emergency departments, and prevents that admission into inpatient units as well. But again, I think it's looking at the evaluation of that, isn't that? And that's where your great work comes in terms of actually proving that investment in those prevention services, working with people much closer to where they live, can make a huge difference, both in terms of their experiences but also the costs overall to the NHS.
Yeah, and it is really important we evaluate work like that. Time and time again, good ideas have come along. They've had a little bit of money for a short period of time. They haven't been evaluated. You haven't had the opportunity to really ask whether they work or not. And then as soon as finances get tight, those good ideas get cancelled. And you've raised people's hopes. You created something really exciting, and then within 2 years it's gone. That's a catastrophic thing to do for those people, but it also means we've lost that opportunity to learn and to build it in. And what happens is that the system as a whole remains completely unchanged. So it is really important that we really look carefully at where innovation is happening, what it's achieving, what difference it's making. Ask difficult questions sometimes. Shouldn't assume all innovation is good and always works. It doesn't. But really being prepared to articulate the evidence where we've got it, and to really show that doing the right things for people is almost always good value for money as well.
Totally. Yeah, really agree. And keeping to that theme around prevention and that left shift, do you think the solution to that and improving ultimately the nation's mental health rests with the NHS or the NHS solely, or do you think we should be looking outside of it for help?
I mean, this has to be cross-government. There's no question that mental health is an issue for the whole of government. It's about the neighbourhoods we live in, the ways in which we're supported to bring up our kids. It's about the schools that children go to, universities, the workplaces, the neighbourhoods in which we grow old. All of these things affect our mental health. There's really compelling evidence, for example, that where benefits are cut, you see significant increases in levels of depression. And where people, for example, have more rights at work, or more financial support, particularly least well off, you see improvements in mental health. So there's really crystal clear evidence that things that can, if you like, reduce the risks of mental ill health or help to bolster people's protections, they do work. Now, that's not to say the NHS is off the hook. I still find it extraordinary that it is still unusual for the NHS to provide people with mental health difficulties with access to advice around money, around housing, around work. This should be fitted as standard at every mental health service everywhere. It should not be by exception. Because we know that for many people, the things that cause someone living with mental illness to get into a crisis, to become unwell, to need hospital care, are very much about their life outside. They're about a crisis in their housing, dealing with problem debts, dealing with relationship difficulties. So we need to think about that as being a fundamental part of mental health care. Because of course, if you're living with mental illness for a long period of time, staying well and remaining independent and having the life you want is fundamentally important to preventing problems coming back or getting worse. So the NHS can't just kind of look around and say, well, this isn't our job. It absolutely is your job, but it helps if government policies are pointing in the right direction. And it really, really helps if local government is on side. We spend a lot of time working with local councils because they control a whole lot of things: public health, social care, but also planning, green spaces. All these decisions they make that have a big effect on the mental health of their communities. So having local government as part of this coalition of the willing as well is also really, really important.
Totally. And it's kind of the complete antidote to some of those challenges that we spoke about earlier, right? Where people are stuck because they're in a certain pathway and waiting for a long time. Actually, if we could just reimagine that and meet people where they are and think about their whole life, like you've said, financial difficulties, relationships, the kind of environment that they're living in, actually meeting them there and thinking about everything that's going on for them and how that support can be wrapped around them. It's a very different kind of picture, isn't it, to to the traditional routes that people would often get stuck in.
And again, that's not medicalizing normal life. It's actually going the other way.
Yeah.
It's seeing that our mental health is a function of the things that happen to us in life. From the very first spark of life, our experiences, our environments, the homes we grew up in, the neighborhoods, all these things. So if we can gear those around creating good mental health and giving people the best chance of having good mental health, doesn't mean you can prevent all mental illness, but you can probably prevent an awful lot, and you can create the conditions that people can live well in. And it's moving away from that notion that our mental health is all about us as individuals or our brain chemistry. I mean, yeah, sure, there is brain chemistry, but it's mostly about the stuff that happens to us in our lives. And it's a collective good. Good mental health is made in communities.
Yeah, absolutely. Andy, we always like to finish off with a bit of a kind of message for hope and thinking about the future and what we'd like to see. So just to finish up, what would you like mental health services to look like in, say, 5-10 years' time? If we reimagine that in the future, what would you like to see?
Yeah, so we had a look at this a couple of years ago. So we've got 8 years to go, and it was great because we talked to people that use mental health services and work in them and around them, and we created this vision. We called it No Wrong Door, and it's really about, first of all, a system which focuses on prevention. It sees people as whole people. So it connects the mental and physical health care together. It provides people with support with work and money and housing and all the other things that matter, helping people who are parents to be good parents, making sure people's voting rights are upheld. You're still a citizen if you have a mental illness. So all these things which are really important to people. And of course, it's crucial we have a workforce which is properly supported, properly looked after, but also that we're never going to have enough mental health specialists, no matter how many we recruit. So how do we bring in people from the physical health world, from communities? I love it when we see mental health services reaching out and training people in their local area to have some mental health skills and knowledge, because then you're increasing exponentially the number of people who can be part of the solution. And we occasionally see examples of services which do take that holistic view. They do meet people's needs in a very non-medical way, while also providing vital clinical and medical care, really, really important part of it. And I think we see that and think that is the way of the future. This can be done. It is possible.
Yeah, totally. I remember that report, and I think we can put that into the show notes. So if anyone listening is interested in taking a look, really recommend having a look at that. So yeah, we'll pop it into the show notes. Thank you so much, Andy. That's been really, really insightful. Really appreciate your time and sharing some of that really important information and kind of bringing it to life, I think, with some of the kind of statistics that are out there and the evidence base that you guys work so hard on at the centre. So thank you so much.
Thank you so much. Thank you.
Thank you for listening to It's All Mental, a podcast from Everyturn Mental Health. If you enjoyed this episode, remember to follow, rate and share. See you next time.